I'm certainly excited to announce that MedStar St. Mary's Hospital, working with partners throughout the greater Lexington Park community, will be one of our state's first 5 health enterprise zones. $750,000 state investment in Lexington Park zone every year for the next 4 years. But this new health enterprise zone, it's about more than money. It's about finding innovative ways of addressing persistent problems, and it's about using more than one tool at a time to get the job done. We're going to build a community health center, but also develop a healthcare transportation route, which is going to help connect patients to their new providers. And that's the kind of creativity and out-of-the-box thinking, the kind of innovative projects that the Health Enterprise Zone program is all about. We have a lot of work to do here in Lexington Park when nearly 1 in 5 residents lives below the poverty level, and we all know there's a correlation between poverty and access to coverage and access to care. So we still have a lot of work to do when there are just 2 primary care doctors and 1 mobile clinic that serve the nearly 31,000 residents in Lexington Park, Great Mills and Park Hall. We still have a lot of work to do. We still have a lot of work to do because here in greater Lexington Park, in St. Mary's County and throughout our state, people continue to be left behind. And we can't let that happen on our watch.
Together, we are so blessed, truly, to have such a great a host of partners that we can all collaborate well with. Whoever identifies the need, we all respond and work beautifully together.
And when we were first made aware of this grant opportunity, we were ecstatic because this is a group of partners who works together so well. We already had vision, and we already knew things that we should or could be doing. And since we had these already deeply rooted partnerships in place, all we needed was the opportunity and the door to open so that we could walk through it. Our vision is to establish accessible, integrated, culturally competent healthcare in the Health Enterprise Zone that is supported by clinical care coordination, prevention services, community outreach, and education. Our core diseases, diabetes, asthma, hypertension, congestive heart failure, chronic obstructive pulmonary disease, and behavioral mental health illnesses are all of the target areas for the HEZ. And this is part of revitalization of Lexington Park. It's not just about bricks and mortar. It's about quality of life. That includes access to primary care, preventing illness, managing chronic conditions, and there are things that a lot of us take for granted, but we have an invisible population here who can't take those things for granted, and we intend to make them visible and cared for. So the HEZ is 16 miles long, or 16 miles in its entirety, and so we'll be putting a van out there. It's a 12-passenger van, 2 wheelchairs, so that if folks need to go from their residential areas in the HEZ to the doctor, to the drugstore, to the parks in the area, to the 2 local gyms in the area, or to the grocery store, they'll be able to use this van to get there and not have transportation barriers to good health.
This grant is very important to me, so pardon me if I'm a little choked up. I have to get to my services here, either from rides from friends, but most of the time I either have to take a bus or a cab, which is very expensive. But anyway, I'm very blessed to be able to be part of you all.
The Commission is looking forward to working with DHMH and others as we implement these health enterprise zones across the state. And as you notice up here in the little little map there, that there are 5 enterprise zones. There are a lot of people that came through with this particular grant, and it was a very, very competitive process. But St. Mary's was very smart in your partnerships, in your networking, and really coming together, and also in your innovation. The fact that you're doing this transportation loop was very innovative, and we're looking at the groups in the communities that were able to pull in federal resources, that were able to come up with really good ideas, and that transportation route was very imaginative, that we can actually help us to replicate it in other parts of the state as other communities are struggling with these same issues regarding healthcare.